Greetings and welcome to the Southside Help Center show. I'd like to thank everyone for tuning in. This is a live call-in show, so if you have any questions about anything that we'll be talking about, please write down our number or give us a call, 312-738-1060. The number here is 312-738-1060. Got a few things we want to talk about. Remember, this is the Southside Help Center show, so we talked about every week we'll have something different and new, and we'll talk about all of our upcoming programs. So that's what we'll be doing this evening. Before we get into that, I definitely want to make sure that we point out a couple of things. Let me go to my overhead right away. We have our overhead because this is something that's so very important, and we've been talking about the Valerie Smith Reed Scholarship Fund throughout. We have an event that's going to be coming up on Saturday, July the 23rd. This is going to be a magnificent event, and it's going to be dealing with the labor of love, which is the Valerie Smith Reed Scholarship Fund, and we'll be talking about what can happen as far as fundraising, what we're going to do as far as donations and so forth to help these kids get to college. If you would like more information about the Valerie Smith Reed Scholarship Fund, please give us a call at the agency. That number is 773-445-5445, and we'll be able to give you more information about the labor of love, the Valerie Smith Reed Scholarship Fund, and the event that we got coming up on Saturday. So please, if you're interested in helping our youth continue on in school, get to college, please be a part of the Valerie Smith Reed Scholarship Fund and help us to get those kids to college and make sure that they can maintain and stay once they get there. So it's very, very important. And we have an event coming up. Mr. Sean Freeman is sponsoring that event for the Valerie Smith Reed Scholarship Fund. If you would like more information about the scholarship fund, give us a call at the agency. The number is 773-445-5445, and we can get you more information if you would like to be a part of that. Coming up on Saturday. We'll touch back on that before the end of the show. But we definitely want to make sure that we're able to talk about what we actually here to talk about today. As you can see, to my left and your right, I have a magnificent guest today. This is Mr. Louis Spraggins. Louis, and I actually go way, 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 way back. I don't want to tell you how far back me and Louis go, but he was a teenager. Yeah. When I first met Louis, and we've been friends. We have done a lot of wonderful things. We've been camping, and we've done some team building stuff all through the years, and he's actually a wonderful friend. Louis is, and we've been around for a long time together. This is Mr. Louis Spraggins. He's my guest today. He's going to talk a little bit about his program and what he's actually offering. And Louis is the regional coordinator for Connect to Care program. It's a new I don't know how new the program is, but we'll let Louis talk about it. But it's a Connect to Care, and he's going to tell you exactly what that is. And we're going to talk about two different things. Connect to Care is a program that we're going to actually bring Louis back, and he's going to give more and more information out about the Connect to Care program. But we also have another program that we want to talk to today. Louis has been in the field for about 16 years now. He's done work across the board. I'm going to let him talk. I don't want to pump him up too much, but he is a magnificent provider. He is a magnificent liaison. He is a magnificent spokesperson for prevention. He is a great individual. He specializes in HIV treatment and education. His purpose for this visit is he want to talk about tell me the name of it again.
BTAN.
I called it Band 2 or something like that, but it's called BTAN. And BTAN has something that's going to be coming up, a training that's going to be coming up, and we want to talk about what that is, what the BTAN program is, and that's why we got Mr. Spraggins here today. Yes, so, yes. I want to go ahead and ask the first question. What is BTAN?
All right, perfect. Mm-hmm. Well, actually, before I even answer that question, I want to say thanks, Mr. Chair, for having me on with you today.
No problem.
I mean, it's the perfect timing. I'm going to explain what BTAN is, but so that you all know, this training is coming up next week. So if you're interested, once you get a chance to hear what the program is about, call us immediately. Call us as soon as possible so that you can get into this training. It's going to be a great training. Mm-hmm. So BTAN basically stands for Black Treatment Advocates Network. And this is a really, really good program. It's a very much needed program.
Absolutely.
It is headed up by the Black AIDS Institute in Los Angeles, California. This is the institute where Southside's Help Center sent me years ago.
I remember.
In order to learn all of the information that I know. So those of you all who may be watching who know me from classes that you may have taken doing treatment education, I got all of that knowledge from the Black AIDS Institute.
Right.
I got all of the experience that helped me to use that knowledge from Southside Help Center.
All right.
And now the two agencies are now coming together, and they're bringing BTAN to Chicago.
So they'll actually be visiting us.
Yes.
So B10 actually goes around the country.
Yes.
Okay,
exactly.
so this is an international program.
Yes.
So it'll actually be visiting us.
It'll be visiting us here in Chicago. They're also doing a B10 chapter in other areas around the country, such as Mississippi. There's 3 areas of Mississippi. There is Atlanta. There is Los Angeles. There is Louisiana, I believe. They're basically going to large populations, areas where there's large populations of black folk.
Gotcha.
And this program is really needed, as I was saying earlier, because traditionally, and I hate to say traditionally, because when you think about tradition, you usually think of something that's good that you do every year, or that your people do all the time because it's tradition. Unfortunately, this is a negative tradition, and the fact of the matter is that black folk tend to have higher numbers when it comes to HIV,
yes.
and we tend to die faster, and we tend to experience more of the illnesses that come with HIV. And BTAN was a project, is a project that was created specifically to meet that challenge.
Wow.
So basically what BTAN does is it allows opportunities.
Don't tell us what it is yet. This is what I want you to do. Make sure, because it's limited space, if you are interested in becoming a part of this training, you definitely need to call. Either you can call us here, we'll make sure that you get that information, or you can call back at the agency. But you have to call and register for the training because it's a limited space, and once it's filled up, then you're going to be out. So if you definitely want to be a part of this particular training, if you like the information that we're talking about, please make sure that you get in contact with us as soon as possible. Either call us here today, or you can give us a call on tomorrow, and we'll be able to get you the necessary information, because a lot of the spots are filled, but there's still a few spots available, and this training is happening next week, correct?
Yes, it is.
And what will it cover? That's what we need to know. What will the training cover?
Good. So the training is going to cover, it's actually going to be a 2-part training, and it's going to cover the science of HIV in the first part, and then the second part, which actually happens a month from now, they'll go over community mobilization. So to break that down just a little bit for the viewers, basically when we say the science of HIV, they're going to talk and teach folks the information about how the virus works, how the virus infects our cells, how the disease progresses. And they're also going to talk about how the things that we can do, those of us who are HIV positive, in order to keep ourselves healthier if we do have HIV. It's going to talk about how the medications work, so how you can get the best out of the medications in order to make sure that you're healthier for a longer period of time.
Absolutely.
And for the service providers, for those who are service providers, not necessarily clients who are positive, but people who are working in the field, it also is going to talk about the issues that are specific to what black folks deal with when it comes to HIV, and how we can get over some of those issues.
Absolutely. This is why we've been saying for a lot of years, and why is it so important that we talk about testing? Why is it's so important that we talk about early intervention? Is this what Lewis is talking about? Is so that we can enjoy a healthy quality of life. Because so many African Americans are impacted by HIV, it is so important that we get as much information, and oftentimes we don't want to know about it, or we don't want to hear about it. And that's a big problem for us. We don't want to get tested because we don't want to know the results. Well, we're talking about why people need to get tested. Why is it so important? So that people can do early intervention, get into treatment and care, and have a healthy quality of life, and we can deal with longevity, because we don't often go to the doctor, or we don't often want to know. So many times this affects us adversely. So we have to make sure that we get those tests done. And here's the thing about behavior. You can tell me anything, but you know what you do. So it's so important that people understand it's not who you are, but what you do that puts you at a greater risk. And if you're at that risk, you need to make sure that you're getting tested. You need to make sure that you're looking at behavior, what you can actually do to make changes. And one of the things that I've realized over the years is it takes years for us to acquire some of the bad habits that we have. So it's not always as easy as it says. So we talk about different ways we can look at those behaviors and make the necessary changes. And that's what a lot of these programs are about. And then when you start talking about HIV and how it affects people, people think that because an individual is impacted by HIV, they know everything it is to know about the disease. And that's not true, or how it affects us. And that's why this particular training is so important for individuals who may be impacted, and also providers, so that people can understand this disease so much better. It's been around for a long time, and we've been talking about how you get it, how you don't get it, how you prevent it. But now we need to talk about how do you stay healthy How do you get educated? And these are the things that we're going to talk about, and this is what will be covered in next week's training. And again, who can be at the training, and what in terms of cost, what does that look like?
Yes. So in talking about who is going to be at the training, BTAN, basically, which is Black AIDS Institute and Southside Help Center, are specifically looking to get people who are black folks who are doing HIV work in the field, specifically with the black community. If you're not black folks, but you are doing the work and you're doing a lot of work with black folks, then this is definitely a training that you should be trying to get into. You know, it will talk about a lot about the cultural competency issues that need to be dealt with when it comes to dealing with black folks. It'll talk about a lot of the specific issues that affect our community in ways that they don't really affect other communities. You know, it'll also, for those of you who are not HIV positive, it also, the general health information that they'll be sharing in the training is stuff that people who are HIV negative can use to keep themselves healthy as well. So it's an all-around great training. It just happens to be focused on black folk and HIV and the black experience when it comes to HIV, whether you're trying to stay negative or whether you're trying to take care of yourself because you're positive. This is a great training.
Absolutely. And we always talk about how HIV affects us as a whole. It's not always about the individual, but it's all of us who make up that individual's life. So it's important that people know who and what this training is about and who it's actually for. We got a caller. Caller, you're on the air.
Hi.
Hi, how you doing?
Hi. I was calling to find out where the Southside Help Center was located and if I can come in and be tested.
Absolutely.
Also, I would like to know if you can give me the 20-minute test.
Okay. And we do provide the rapid test, which is a 20-minute or quick test. It takes about 20 minutes. You can come to the office. Our address is 10420 South Halsted. We're on 104th and Halsted. It's 10420 South Halsted. As far as the landmark, we're right across the street from the subway. So it's 10420 South Halsted. You can either come in between the hours of 9 to 5, give us a phone call. If you want to set up an appointment, the number is 773-445-5445. You can reach me at extension 17 and we can set up an appointment and you can actually come in and get tested. So thank you for that call. And it's so important that people know their status. And we've been talking about why people need to know their status, because we're affected differently with this disease. And we need early intervention. It's so important that we get early intervention. And I remember back early on, most people were not getting tested when they found out the disease had progressed so far. So it's important that people know their status. That's what this is all about, knowing your status, staying healthy.
In particular for black folk, I mean, you know, we tend to get tested, as you said, much later on in disease. So we may have become positive 10 years ago, 15 years ago, but we put off being tested so long that by the time we go in, you know, the disease has already progressed. And this sister who just called in, I'm really glad that you're talking about getting tested, because the whole thing is that if you find out early, if you find out as soon as possible, as soon as close as possible to when you first became infected with the virus, that's when you have the best chance to really take care of yourself and live your full lifespan. That's how far we've come with treating HIV nowadays. You know, you can live your full lifespan for the most part as long as you take care of yourself. But you can't do that unless you actually know your status.
Absolutely.
So it's not about running around being afraid of finding out what it is, because I know a lot of us, we say, you know, I'd rather drop dead than go worry about it. But the point is that you're going to be worrying anyway while you're getting sicker and slowly dying at home. But if you know what's going on, you can go out, you can seek help. Folks at Southside Help Center, Mr. Cherry, myself, there are folks all around the city who can connect you to care so that you can live your full life and a healthy life on top of that.
Absolutely.
Being happy, doing what you want to do, climbing mountains, going camping, playing basketball, whatever it is you want to do, you can do it as long as you take care of yourself.
Absolutely. And as far as testing goes, and that's why these tests, the OR quick tests, are so very accurate. And as Mrs. Spraggan says, is identifying at what point you're actually affected, especially early as possible, so that you can get involved with treatment and care. And one of the things that I always talk about is how Magic remains so healthy. Magic has always done all of the things that he's supposed to do. He had early detection, and since that date, from that date to this date, he eats right. He works out and exercises. He has a relationship with his doctor. He does all of the right things. It ain't about no money. It's about a lifestyle. and it's improving the quality of life. And that's why we talk about testing, and that's why we talk about people knowing their status so that they can get into treatment care as early as possible. And these tests are very, very accurate. The OraSure is a very accurate test. It's so very effective that even there's even been known in cases for people being infected in the test a week, pick it up. So it's so very important that people do get tested, and that way they can get into treatment and care and get what all they need in order to stay healthy. Here's one. How can people get involved, or how can people get signed up for the training? That's important as well.
Great. Definitely that. So the training is happening next week, Monday, Tuesday, and Wednesday. Okay. And it'll be all day. And I didn't answer your first question earlier, your second question earlier, which was how much will it cost?
Yes.
The cost of the training is nothing. It is free. All it will cost you is the time to come there and to sit down and talk and learn some things. Okay. So come on down, and not only that, they feed you breakfast and they feed you lunch.
What time is the training?
It will start, we have the flyer there. It will start at 9.
This is the one we're looking
at?
Okay.
All right, so we're going to take a look at the flyer there. Training will start that morning.
From 9 a.m. to 5.
9 a.m. to 5 p.m. So it's a full day of training. It's going to be taught. If you all know Keith Green, this brother is wonderful. He does great work all over the city of Chicago. He's a fast rising star, and I expect great things from him. Folks who know him know that he knows his information, and he knows how to share it so that you will also know the information. So 9 to 5 p.m. next Monday, Tuesday, and Wednesday. How can you sign up for the training? Basically, you give me a call. Give me a call at Southside Help Center, 773-445-5445. My extension, 4232. Or if you end up talking to the receptionist, ask for Louis Spraggins. You get transferred to me, and I will get you hooked up. Basically, I'll send you the application. I can either email it to you, or I can fax it to you. You can fill it out. It's a real quick, real easy application. Send it back in. We have a total right now, I believe, of 18 people signed up for the training. We're going to cut it off at 25 people. We've been thinking about pushing it to 30, but we're probably going to cut it off at 25. So we have about 7 spots left. And we really, really want folks to get into this training, because it's going to help to raise the level of the work that you do when it comes to Black folks and HIV. So if you have any interest whatsoever in attending this training and learning more and improving the good things that you're already doing in our community, then this is the training for you. So give me a call at Southside Help Center. I'll get you hooked up.
Absolutely. And let me say as well, Southside Help Center has a program, a bank program, which is a national capacity building program. And we've been, this is not the first time around for us, but we've been providing training all across the country for other organizations. So it's so very important that you know the history of Southside Help Center. We've been around for about 25 years and have been providing great training. So if you would like to become more efficient and more effective, please become a part. And we always talk about the passion that's required, because most people to do the work still have to have a lot of passion. One, because there's not a whole lot of money, and two, because we work from federal to state to local and private. We work off of funding, and that's not always intact. So a lot of times we have to have a level of compassion to actually do this work. So that's why we talk about training, and this is how you become more effective. This is how you become more compassionate about the people on which we service. So the more you know about this disease and how it affects people, the more effective you become in providing services. And that's what Louis said. Even if you're not African American, but you're providing a service to a lot of African Americans, you need to get involved in this training. This is a training that will help you to understand this disease. This is a training that will help you in the translation of information, which is what we do, because people who are impacted with the disease still want to know what's happening, what's going to happen, how is it going to happen, and you can talk to them about that. And that's what this is all about when you start talking about capacity building and training, stuff like this particular program or this particular training, and why it's so important that providers as well as the people who are impacted by this disease get involved. So remember, it's only a few slots left. If you would like to get involved in this training, please give us a call here today. Give us a call tomorrow at the agency. The training is filling up fast, and we want to make sure that we have every seat filled. And even if they're talking about pushing it, maybe that'll be possible, but please get involved. It's so important that we do become more effective in providing our HIV information. You have a call? Call, you're on the air.
You have a call? Call, you're on the air.
Hello?
Yes.
Hi.
Hi.
Hello. You might want to turn your television down.
Okay. Okay, hello?
Yes.
Yeah, we hear you. What can we do for you?
Okay, I'm calling to see, I'm watching y'all commercial, and I was wondering, y'all looking for volunteers for this stuff too?
Well,
We can always use volunteers. There's always work to be done. I mean, in truth, as Mr. Cherry was saying, because of the fact that there ain't so much funding around when it comes to this very important work, it's amazing that there's no funding. There's very little funding for work that's this important. But the way that many agencies also keep going is by having volunteers come in to help out with the work. So if you're interested in volunteer, call. Call, let folks know that you want to help out, and that let us know what your skills are, what you can do, and we'll put you in a spot where what you can do is very valuable.
absolutely. And we do have a volunteer program, so please, you can call us at the agency, 773-445-5445. We'll have you come in and fill out a volunteer application, and we can look at where we can actually use you. We always got programs coming up. We're always actually in the community providing particular services, and we always need some help. As a matter of fact, we have several events coming up in August, back to school events or community events where we'll be doing testing and counseling, and we'll be having people to man the tables and that sort of thing. So we always can use volunteer, and we encourage that people come out and volunteer. And the other thing about volunteer work is you acquire so much knowledge, because the one thing that we're always looking to do is impart knowledge, and that's the biggest thing we have in the community, is to make sure that the information that people getting is accurate.
Yeah.
So oftentimes, even in this day and age, I still hear so much information that is not correct. So it's important that people come volunteer, get these the informational trainings, and they can always go back to the community as well and help provide HIV prevention and education. So we do thank you for calling, and again, give us a call at the agency, 773-445-5445, and we'll set up an appointment for you to come in and fill out a volunteer application so that you can help out. So thank you.
Yeah, so you should know, volunteers are also welcome at the training.
Absolutely.
Testers, advocates, anybody who's doing work in the black community centered around HIV and AIDS, give us a call. Great training. You'll love it.
You'll absolutely love it. We're not going to go into the Connect 2 program, but we want to make sure Connect the Care program, we want to make sure that you know that that'll be upcoming. And what we're doing is, this is the Southside Help Center show, so we have an opportunity every week. We'll be on at 5 o'clock, and we'll be talking about the different programs that the center offer. And that's one of the programs that we'll be talking about upcoming. Next week, we'll be talking about case management. Most of our case management deals with HIV positive clients. So if you in fact are or know someone who is in need of those type of services, please tune in for next week, because we will be talking about case management. Our case management deals with housing. Our case management deals with treatment and care. Our case management deals with referrals. And the one thing the case management is it helps people to navigate through the system. The system can become extremely difficult when we are impacted. It becomes difficult because our thoughts are very different. So it's important that we get individuals who can actually help us to navigate, and that's what case management does. It helps people to navigate, come in and set up appointments with the case manager, and they show you and guide you and direct you on what you need to do next, step by step by step. You can call it hand holding or whatever, but do not be confused. Every now and then we all need our hands held for one reason or another. So that's what we'll be talking about on next week, is case management. We're going to have Mr. Spraggins back in probably a couple of weeks, and he'll be talking about the Connect Care program. So we'll be looking for that as well. We'd like to thank Mr. Spraggins for coming out and talking about the BTAN program. And again, if you'd like to be involved in that program, give us a call at the agency. The number is 773-445-5445. We'd like to thank everyone for tuning in, because you are who make us what we are. And again, this is 25 years for us. Don't forget about the Valerie Smith Reed Scholarship Fund. Really quickly, this is an overhead. If you'd like to be a part of that, please give us a call at the agency. That number is 773-445-5445. Please give us a call. We'd like to thank everyone for tuning in, and until we see you again, we bid you peace.